Welcome to the Sleep to Dream Analytics Explainer video, where better sleep starts with better understanding. So, if you've got sleep apnea, you've definitely heard of the CPAP machine, right? But what if I told you there's another way? Today, we're going to dive deep into a really solid, widely accepted alternative for treating snoring and obstructive sleep apnea. Let's get into it. You know, for so many people, the whole routine with the CPAP, the mask, the hose, that constant noise, it can be a real struggle every single night. If that sounds familiar, if you've ever felt that frustration, then you are in the right place. We're about to break down a powerful alternative that might just change the game for you. Okay, so first things first, let's just quickly touch on the core problem here. Obstructive sleep apnea hypopnea syndrome. You'll see it as OSHS. This is simply the condition where your airway gets blocked over and over again while you're asleep, which, of course, stops air from getting to your lungs. Now look, let's be clear about one thing. Positive airway pressure, or PAP therapy, and that includes CPAP, is definitely the most common and technically the most effective treatment out there. What it does is pretty straightforward. It uses a constant stream of air to literally prop your airway open so you can breathe. But, and this is a huge but, a treatment, no matter how amazing it is on paper, is completely useless if you don't actually use it. And the reality is, tons of people just can't stick with their PAP machine every night. And that's the whole reason we're even talking about this. That gap between what could work and what people actually do has created this massive need for other reliable options. All right, so let's pull back the curtain on this alternative. It's called an oral appliance, or you'll hear me say OA for short. So what is this thing? Well, think of it like a super high-tech mouthguard, or maybe an orthodontic retainer that you only wear when you sleep. The most common kind, the one with the most science behind it, is the Mandibular Advancement Splint, and its whole job is to gently shift your lower jaw just a little bit forward while you sleep. Okay, this part is so important. You have to understand that not all oral appliances are the same. Not even close. You've got custom-made, adjustable ones that a dentist fits perfectly to your mouth, and then you have the over-the-counter boil and bite kind. The science on this is crystal clear. For actually treating sleep apnea, you need a custom-made adjustable device from a dentist. Those other ones just don't cut it. Okay, so how on earth does moving your jaw forward actually help you breathe? It's a great question, and it's a little more clever than just, getting your tongue out of the way. It's actually changing the whole geometry of your throat. When you move the lower jaw forward, you're increasing the total space back there, especially from side to side. You're creating a wider, more stable pipe for the air to flow through. All right, time for the main event, the showdown. How do these oral appliances really stack up against the reigning champion, CPAP? Let's get into the numbers. So if we're just looking at one single number, the pure, raw power to reduce how many times you stop breathing per hour, which is your AHI score, well, CPAP wins, hands down. This chart shows it just brings that number down way more than an oral appliance can. But, and I cannot stress this enough, that is not the whole story. And this quote from the research, man, it just nails the entire issue. Basically, what it's saying is that CPAP's extra power doesn't really matter if people can't stand to wear it. Because people are so much more likely to actually wear their oral appliance all night, every night, the real-world results, the effectiveness, ends up being nearly identical. And this is where it gets really fascinating. When you start looking at the stuff that you actually feel day to day, like are you less sleepy? Is your quality of life better? Is your blood pressure going down? The results are pretty much the same for both. But then you look at the bottom two rows. Patient preference, way higher for oral appliances. And adherence, how often you actually use it, again, much higher. It's the classic trade-off, a little less raw power for a whole lot more usability. Okay, so all this probably has you wondering, well, is an oral appliance right for me? Let's figure that out. So the research points to a few things that suggest you'll have a really good outcome with an OA. Generally, it works best for people who are a bit younger, have a lower BMI, and are in that mild to moderate sleep apnea range. Oh, and it's a great option if your apnea is what they call positional, meaning it gets way worse when you sleep on your back. Now, on the flip side, there are some situations where an oral appliance probably isn't the best place to start. For example, if you have really severe symptomatic apnea that needs to be controlled like right now, or if you have a totally different kind called central sleep apnea. And this is a big one. Since the whole thing anchors to your teeth, you have to have a healthy mouth. That means enough strong teeth, no major gum disease, and no severe TMJ problems. Okay, now we're going to talk about something fascinating.
a connection that a lot of people have no idea exists, the link between sleep apnea and grinding your teeth.
So listen up. If you're one of the millions of people who wears a regular night guard for teeth grinding, what doctors call bruxism, this next part is for you. Because that little plastic guard you're using to protect your teeth, it might actually be making your breathing worse. You wouldn't think it, but the overlap here is absolutely massive. Some studies show that up to half of all people with sleep apnea also have sleep bruxism. They just go hand in hand. And here's why that matters so much. Your standard night guard, all it does is put a cushion between your teeth. It protects them, sure, but it can actually take up precious space in your mouth, potentially making your airway even smaller. But the Mandibular Advancement Appliance, it's like a 2-for-1 deal. It protects your teeth, yes, but it's also opening your airway to treat the apnea. And get this, by treating the apnea, it often reduces the grinding itself. You're treating the symptom and the potential cause at the same time. Okay, let's wrap all this up. What does this all mean for you and your sleep? All right, here are the key things you need to remember. First, oral appliances are a proven first-line therapy for mild to moderate sleep apnea. They're not just a plan B. Second, when it comes to the health outcomes you actually care about, they are just as effective as CPAP, mainly because people actually use them. Third, the key to success is getting a custom-made, adjustable device. This has to be a team effort between your sleep physician and a specially trained dentist. And finally, fourth, the best treatment is never one size fits all. It has to be personalized to you, your body, and your preferences. Now, it's also good to know what to expect. When you first start, you might feel some temporary things, like a dry mouth or a little bit of jaw stiffness in the morning. That's totally normal, and it usually goes away. But over the long haul, it can cause tiny changes in your bite, which is exactly why you need to keep seeing your dentist regularly. They'll keep an eye on things. So look, CPAP is an amazing treatment, but it is not the only treatment. For millions of us, especially those with mild to moderate apnea, or for anyone who grinds their teeth, an oral appliance is this comfortable, super portable, and incredibly effective option. Which really leaves us with just one last question for you. Could a simple conversation with your doctor and a dentist be the next big step on your journey to better sleep? Thank you for watching the Sleep to Dream Analytics Explainer video. We hope you sleep well and dream easy.